Hello everyone, welcome to Orthopaedics Essentials. Today we are going to discuss another important topic for ward round, that is dressing materials. Now, what is dressing? Dressing is application of sterile material directly over the wound to protect it, to control bleeding and discharge, to promote healing and prevent infection. What are the objectives of dressing? The objectives of dressing are to it controls the moisture, it protects the wound from infection, it enhances the process of slough removal, it maintains the optimum pH of the wound, and it also maintains the optimum local temperature. Layers of dressing, that is contact layer, absorptive layer and compressive layer. Contact layer of the dressing is the one which we apply after application of dressing chemicals over the wound, like cotton gauze pieces are kept directly over the wound. This is the contact layer. Absorptive layer. After application of the contact layer, we apply dressing pads like Gamgee pad or thick gauze piece which are kept over the contact layer. They have absorbent property. One must remember that absorptive layer is the thickest layer of dressing. Then comes compressive layer. Here the cotton roller bandages or elastic bandages are applied to keep the underlying layers in place and also to control swelling, to control bleeding or discharge. With this background, let's study about different dressing materials. Before this, we should know that in an orthopedic ward, we prepare two separate dressing trolley, one for contaminated wound and other for clean wound to prevent cross contamination. A dressing trolley consists of a surgical drum in which sterile gauze pieces, dressing pads, cotton rolls, and roller bandages are kept. A Sidex tray with scissor, artery forceps, needle holder, and thumb forceps are kept. A kidney tray. The concavity of the kidney tray should matches with the curvature of the body part. A transparent glass bottle with Cheetle's forceps. The mouth of the glass bottle should be wide enough to prevent the jaw of the Cheetle's forceps touching the mouth of the glass bottle or to prevent cross contamination. And there is a cotton soaked in Savlon solution in the glass container. Now there is a controversy that the Savlon solution contains cetrimide which acts as culture media for Pseudomonas. So ideal answer for Cheetle's forceps is one should keep the Cheetle's forceps in a sealed packet after sterilization and should be used separately for every dressing. Alright, what is the use of Cheetle's forceps? It is used for picking up the sterile items from either surgical drum or from the Sidex tray. Surgical drum. In surgical drum, we keep the sterile roller bandages, gauze pieces, and Gamgee rolls and Gamgee pads and crepe bandages. Now, if you can appreciate, you can see there are multiple fenestrations at the lower part of the cylinder. During sterilization, we keep this fenestration open, and once the sterilization is done, I don't know whether you can appreciate, there is a belt-like structure in lower part of the cylinder. After the sterilization is completed, we rotate this belt so that the fenestrations are sealed by this structure and locked. Different materials that are kept in surgical drums are gauze pieces, roller bandages, Gamgee pads and Gamgee rolls, crepe bandages. One should know the number of holes in a in a gauze piece per square centimeter, which is 4 into 4, that is 16. Right? The Gamgee pad was invented by Dr. Joseph Samson Gamgee. It is available in form of Gamgee roll or Gamgee pad. It has a high absorbent property. It promotes quick healing of the wound. It is skin friendly. Right? Crepe bandage. It is made of cotton, polyester, and elastic yarns. It creates an even stable pressure around the area of application, therefore reduces swelling, and compression bandage also reduces the bleeding. It has hemostatic effect due to the compression. We use it for strapping of the sprain and strain around the joints. We use it for splintings of fractures as in skin traction. We also use it as a post-operative compressive bandages. We have already discussed about Cheetle's forceps. Now in adhesive surgical tapes, the dynaplast or elastoplast are important. They are stretchable tapes which have adhesive, that is zinc oxide, which is whitish in color. And what is the use of this elastoplast? It is used for strapping around joints. It is also used for strapping in case of fracture, for the immobilization of the fractured segment. It holds the dressing or the bandages over the wounds. Now we are going to discuss important chemicals that we use for dressing. Easier way to remember these chemicals are the chemicals that we use in home are Savlon and Dettol. Chemicals that we use at hospital are povidone iodine, chlorhexidine solution, and surgical spirit. There is only one liquid with adhesive property, that is tincture of benzoin. Then there are some liquids that we use when things go south, that is hydrogen peroxide, U-sol, oxyferrin or oxum, silver nitrate solution, etc. and diakin also. Savlon solution. The color is tartrazine yellow. It consists of cetrimide 16%, there is controversy that it act as culture medium for Pseudomonas. Apart from cetrimide 16%, there is chlorhexidine gluconate 7.5%, isopropyl alcohol 6.8%. So isopropyl alcohol is 6.8%, chlorhexidine gluconate is 7.5%, and cetrimide is 16%. So isopropyl alcohol is percent, chlorhexidine solution is percent, cetrimide solution is percent. Effect: cleansing and disinfectant, whereas Dettol is antiseptic and disinfectant. Savlon is cleansing and disinfectant. Savlon is antiseptic and disinfectant. Now, Savlon 1 to 30 dilution for dirty wounds and 1 to 100 dilution for scrubbing and thermometer storage. Whereas Dettol is used in minor cuts, wounds, household cleaning of slaughterhouse walls, etc. And its composition is 4.8% chloroxylenol with in terpineol. Right? In milky emulsion, it is a milky emulsion of oil droplets when diluted in water. Right? Now, povidone iodine solution. Now, iodine in itself is non-soluble and has irritant property. Right? It has irritant property. Here the iodine and povidone. Povidone is carrier molecule. Iodine is the bactericidal agent. Right? It has a name, polyvinyl pyrrolidone iodine. Povidone iodine comes in three forms, that is solution, scrub and ointment. Solution is available in 5% and 10% concentration. 5% is usually used for dressing, whereas 10% is used for surgical site preparation. Now for scrubbing we have 7.5% povidone iodine solution. For ointment we have 10% povidone iodine ointment. The advantages are this is a broad spectrum antiseptic with stable, less irritant, active against bacteria, fungi, protozoa, virus and yeasts. That's all. Thank you.